Good evening, James, and thanks for your time tonight. All eyes right now and efforts are being geared towards developing some kind of vaccine, but you're suggesting that experts should start a few steps before that.
That's exactly right. I think one of the key things that we have learned from fighting the HIV epidemic is that although a vaccine may be the ultimately most effective way of preventing a disease like HIV or COVID-19, we can't wait for the world's development of a vaccine to happen. We still don't have an effective vaccine, obviously, for HIV, yet we have a very effective form of prevention in the form of taking a pill every single day that reduces the risk of acquisition by over 99% of HIV. A similar method, a similar approach could be used to prevent COVID-19. But as our report demonstrates, the world's efforts to find a form of COVID-19 PrEP are uncoordinated and extremely inefficient.
It's interesting because when you talk about something that could prevent people from contracting COVID-19, there are trials currently being run to see what the impact of the TB drug BCG, I believe, might be on individuals. Do you think that initiatives like that could lead to some kind of PrEP drug being developed?
Well, the trials that you mentioned involve looking at whether the BCG vaccine could prevent COVID-19. But similar trials exactly like that look at various different drugs, whether they actually can prevent rather than just treat the acquisition of COVID-19. One of the things that we found is that almost the vast majority of clinical trials going on right now are only evaluating hydroxychloroquine, a drug that Donald Trump and other presidents and other political officials have touted without very much scientific backing. And the very basic procedures for research and development that are in place right now are woefully insufficient. So we may be missing the potential of an existing drug that is already available to prevent COVID-19, and we wouldn't know it just because the R&D processes are so inefficient going on in the United States and across the world.
So then how differently would the approach need to be towards the treatment aspect of it, the trials for vaccines, but also then taking into account what you're saying, developing some kind of PrEP drug?
I mean, so the basic sort of laboratory research could be very, very similar between the two. The trials need to be very, very different. Because a clinical trial that's evaluating a treatment is going to be enrolling patients as, of course, a treatment, a preventative drug that takes people who are at high risk of getting COVID-19 but don't already have it. And there's very different design aspects of the clinical trials that need to be put into place. That level of coordination going on in the preventative trials versus the treatment trials. And once again, we understand why everyone wants a vaccine too. But we shouldn't put all of our eggs in the vaccine basket. It may be years, unfortunately, before an effective vaccine is developed. And until then, we really need to make sure that we are trying to find not only a vaccine, but a PrEP modality as well.
It's interesting because you also highlight that you believe that the current leadership that's driving some of the research into the different trials that are taking place is uncoordinated, and that it also lacks funding. Ultimately, when you look at this from a global perspective, who do you think should be driving this process?
So I think that there's a real important role for international coordination going on here, right? The World Health Organization right now is running a clinical trial in multiple countries called Solidarity that's evaluating 4 different treatments for COVID-19. We would like to see the same sort of international coordinated clinical trial structure being developed for COVID PrEP as well. And we're just not seeing that right now. And it goes back to funding, right? We would like to see the NIH to the United States National Institutes of Health, as well as other global partners, to really put a clearly delineated budget that's probably in the hundreds of millions, if not billions of dollars, that is specifically looking for COVID-19 PrEP. Because if we actually develop PrEP, the impact on the world could be, a game changer. We could see people being able to come out of social distancing. We could see frontline responders like healthcare workers be protected far more than they are today from getting COVID-19.
Given the fact that, just on the issue of funding, monies that were previously donated to the World Health Organization from a country like the US, that seems to be on hold indefinitely right now. How big a setback do you think that is?
I think that's a big setback, not only obviously for the development of PrEP, of COVID-19 PrEP, but for the entire global pandemic response. And the idea that we are cutting the World Health Organization budget in the middle of the largest global pandemic in 100 years is just outrageous. And to be honest, as an American citizen and as someone who lives in the United States, I'm very ashamed of the role my country is playing in perpetuating this crisis by doing that.
All right.